59-year-old woman comes to the physician because of left leg swelling that started after transcontinental flight. A duplex ultrasound of left leg shows non-compressible popliteal vein. A drug is prescribed to inhibit coagulation cascade. 2 weeks later, laboratory study shows platelet counts. You can see we have increased prothrombin time, PT, and we have increased prothrombin, and thrombin time is normal. So what drug was she prescribed on? Patient has both increased PT and PTT. So the patient here is having, it's given apixaban or direct factor 10 inhibitors. Remember, PT is increased. It's usually 35 to 50 around ish, while here it's 5 to 15. Okay, so thrombin time is normal. So we can start ruling out the option like L-tryptase, which does not affect PT or PTT. Dabigatran, this usually have no effect on PT or PTT. It decreases the thrombin time, but thrombin time is normal. Aspirin does not affect PT or PTT. It affects platelet aggregation. Unfractionated heparin only affects PTT. PTT, and warfarin affects PT or INR. So by method of elimination, we came to the answer of apixaban, or we can remember via mechanism of action, that is factor 10 inhibit. So remember here, certain factors on intrinsic pathway, and there are certain factors on extrinsic. Extrinsic pathway works via warfarin, an intrinsic pathway which causes PTT is heparin. Okay, so normal is 15 to 39 or 40 seconds, while PT is normal is 12 seconds. Okay, you can see prothrombin is converted to thrombin where the factor 2 is converted to thrombin. Here you can see both common pathway meeting at factor 10. So if we block this factor 10, we will have increase in PT and PTT. Remember, heparin is parenteral IV. It works rapidly and it's monitored by PTT, while warfarin is monitored by PT or INR. Certain that inhibits the thrombin or factor 2, that's a dabigatran or gotraban. This inhibits the factor 2, and it's usually used for venous thromboembolism and atrial fibrillation. Okay, you can see it can be used in HIT, heparin-induced thrombocytopenia. Bleeding is reversed via idrisumab. Okay, but remember, this does not require any lab monitoring. While apixaban, rivaroxaban, and etoxaban blocks the factor 10A. It's used for prophylaxis of DVT and pulmonary embolism. Its bleeding is reversed by adrenaxate alpha. Remember, its effect is reversed by adrenaxate alpha. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.